going to talk about Xochitl's case, a problem with cirrhosis of the liver, which it was resolved completely. She's 11 years old and her health condition has been resolved completely. We also resolved a case of diabetes and chronic fatigue syndrome. I received a call from Xochitl's mom from Tampico, Tamaulipas, asking me if I can resolve a serious case of liver problem. This family was waiting for a liver transplant and couldn't get the so-awaited liver. The liver transplant is a very serious surgery, not only because it's a complicated surgery, but because Xochitl is only 11 years old, battled with obesity and a serious case of renal problems. I said I can help. The family traveled to Guadalajara to meet me. Xochitl was treated at El Iste Hospital in Tampico, Tamaulipas, and also in Iste of Guadalajara in Zapopan, at the Valentin Gomez Farias Hospital. I proceeded to diagnose her health and I gave her a treatment based on magnets and sounds. Xochitl began to recover from her problems of cirrhosis of the liver, also called hepatic steatosis, and obesity simultaneously. Within 8 days, you can notice a great change with the cirrhosis of the liver. She was showing a great change, was now retaining nutrients, since the gallbladder was also showing problems, was not working normally. The second case is Xochitl's grandmother. She was diagnosed at the Iste Hospital in Tampico, which she needed a dialysis because she had substantial damage in both kidneys. She also had hypertension and heart problems. The treatment lasted 30 days, and she recovered from her right eye vision completely and regulated her blood pressure. The third case is Xochitl's aunt. She had a strong virus very similar to AIDS, which lowered down her defenses and her immune system, and was extremely tired all the time. It's notorious to observe that the 3 patients from this family nowadays have not needed medication after a year and a half since they've been treated with me. Also, the 3 members were experiencing chronic fatigue syndrome, and it was resolved satisfactorily. Be aware that the chronic fatigue syndrome is a problem occurring around the world, with half of the population affected this year, 2013. Interview with Xochitl. Hi, I'm Victoria Alcala. We are residents of Tampico, Tamaulipas. We brought my daughter because since 2005 she had epilepsy. She was treated at the hospital Valentin Gomez Farias since 2005, but in May 12 of 2012 she had more symptoms. In March 7th we checked her in at the hospital because she had abdominal pain and we didn't know what she had. It caused us problems because it was all over this area. On March 7th, she was hospitalized around 11 a.m. On March 7th, during late hours, we were giving different diagnoses. I was told it was a possible appendicitis or possible problems with the gallbladder, also saying it was the mucus going through her throat. Different diagnoses I was not happy with. So I called Dr. Roberto Valverde so he can give us a diagnosis through his therapy. We were told that she had a few epidemic problems from the pandemic event we are witnessing now. She had her blood sugar elevated, meaning diabetes. We were monitoring Xochitl during March and April, and on May 1st, she had an appointment at the Valentin Gomez Farias Hospital where she was going to get a tomography. Xochitl, an ultrasound. Mother, it's a gallbladder ultrasound. Mr. Roberto Valverde told us that she may get a little dirt showing in the gallbladder ultrasound, but she came out very clean from the ultrasound. Roberto, when did that happen? Mother, it was on May 2nd of 2012. She had an appointment. She came out clean. That was because since May, she was using her magnets. Since March 14th to May 2nd, thanks to the therapy she received from you. She came out clean in June. In the month of June, between the 10th and the 19th, she had an appointment with a neurologist. She was sent to do an electrogram, and after using the magnets, just as you said, to do it. Her electro came out straight without shoots, and then the doctor, Margarita, gave her the certificate of discharge. Roberto, has she had convulsions? Mother, no more convulsions, doctor. She has not had them or the shaking of her head anymore. The lab results at the Valentin Gomez Farias Hospital showed she no longer had problems with her health, which her doctor, the specialist, determined she was okay to get her certificate of discharge. Second testimony. Mother, doctor, we are here with my mother. She was diabetic and hypertense. She was about to get dialyzed this year, 2012, in March and April because her kidney was only working 50% and needed to be dialyzed. After we came in February of 2012 because the doctor had diagnosed the dialysis. We were here with you and you gave us therapy, magnotherapy, and music therapy. My mom left fully recovered. In March of 2012, we had an appointment where she did have some lab tests for the dialysis and it came out favorable. The specialist told us that her kidney was now working and she escaped from getting dialysis. She was dismissed from getting dialysis thanks to your studies, and we are here to do a follow-up on her health, on this lab test that we got shows that she is free from diabetes. On the lab results,